So our next medication is citicoline. So our classification is neurotonic or nootropic. So mainly ang function niya, in-increase niya yung brain activity and it preserves the remaining neurons and as well as CNS protector siya. It increases cerebral blood flow and oxygen consumption of the brain and improve cerebral circulation and metabolism. So, under study pa din siya to be parang, kasi umatid ako ng isang seminar sa stroke, so sabi nila under study pa yung citicoline. It's also believed to protect nerve cells. So, yun. And indications niya, so more of the CNS, cerebral vascular disease, cerebral surgery, Alzheimer's, head injury, and disturbance in consciousness. Side effects, here are the side effects. And sa nursing management, so we'll just focus more on this. Take it with or between meals. Special attention should be paid for administration with the neonate and the pregnant women, and contact the physician if with allergies. And citicoline therapy should be started within 24 hours of a stroke. And the physician will prescribe the correct dosage. So, sa mga practice dito, mga residents natin, they give citicoline initially IV within 24 hours. Dahil daw acute, lalo na pag-acute. Then, our next, one of the most important medications is nimodipine or the Nimotop, which is, ano siya ng Bayer ba yun, yung nadidistribute. This is a dihydropyridine calcium channel blocker. Originally developed siya for the treatment and indicated siya for high BP or increased BP. It is not frequently used for this indication but has shown good results in preventing a major complication of subarachnoid hemorrhage or even other cerebral hemorrhage termed vasospasm. And yun yung main use niya, yung to prevent vasospasm. Because it has some selectivity for cerebral vasculature, so that is why yun ang indication niya for cerebral vasospasm because of its, parang selective siya, nakakapasok siya or nakakapass through siya doon sa cerebral vessels. So, it prevents cerebral vasospasm and resultant ischemia, which is a complication of CVA bleed, specifically from ruptured intracranial bearing aneurysms. So, yun, yung nimodipine. Then, the contraindications niya, of course, if associated with low blood pressure, flushing and sweating, and here are the common side effects. So, next. Then, the phenytoin, most commonly known as Dilantin, yung kanyang brand name. Phenytoin sodium is a commonly used anti-epileptic. So, phenytoin acts to suppress the abnormal brain activity, syempre to prevent further brain damage or cerebral damage and to prevent the increased ICP. So, prescribed for, it is an anticonvulsant or anti-seizure medication used for preventing or treating generalized tonic-clonic seizures. So, binigay ito sa patient natin primarily because of the patient had previous episode of seizure. Then, let's move on with the labs or diagnostic tests. So, these results are specific to the patient. These are the actual results. So, for the CT scan, cranial plane, the results are fairly extensive subarachnoid hemorrhage, so positive. Background of cerebral edema, that is why we have mannitol. With here we have citicoline and nimodipine. Evidence of communicating hydrocephalus with intraventricular hemorrhage, and then underlying ruptured aneurysm is considered by the radiologist. So CTA is suggested, the CT angiogram. Thus, after doing the CT angiogram, the result is left anterior communicating artery aneurysm. So it's positive for the aneurysm. So the blood exams, in terms of hematology, the CBC, so hindi ako masyadong nakikita eh. So, the remarkable is the WBC, increased 23.5. The rest are almost normal. Dahil nang tinanong ko yung neurosurgeon, of course, because you have an affectation with the brain, and so nag-increase yung ating mga WBC. So, this is what they call parang central. But still, nagbibigay pa rin sila ng antibiotics. So, it depends upon the in the neurologist or the physician. Some physicians hindi na kasi daw it is expected to have an increased WBC because of compensatory mechanisms. And thus affected din yung mga nagpo-produce mo yung sa metabolism mo sa brain dahil affected sila, na-affected yung metabolism. A day after, lalong tumaas yung WBC. This was the time they shifted the antibiotic from cefuroxime to piperazine and tazobactam. So they come up with a higher or generations, mas malakas na siya. And then another result, after nung binigay yun, medyo bumaba na yung WBC mo from 20 plus, ano ba yun? 23, naging 21.8. But still, the new remarkable naman na result is the increased platelet level. In terms of blood chemistry, so, initially, ito bago na to Crea niya is 1.00, which is normal. And then the potassium is 3.8. Pero previously, ang nauna niyang Crea ay, next,